Welcome, guys, back to the Grateful Living podcast. Today, I'm thankful to have Cristian Leiva with me. Christian is a data scientist professionally. However, today he will talk about living with multiple endocrine neoplasia type 1, known as MEN1, and also known as Wermer's Syndrome. MEN1 is a rare heritable disorder that predisposes individuals to tumors in the pituitary and parathyroid glands, as well as the pancreas. Christian, thank you so much for joining us.
Thank you, and I'm pretty happy to be here with you.
Of course, thankful to have you on. So, just for the people that don't know you as well, do you want to just give a little introduction on your background, maybe where you grew up, your family situation, things like that?
Yes, sure. Um, so I grew up in Chile, in Santiago. I'm a statistician. My bachelor degree is a statistician, and then before going to study at the university, I developed this rare illness at 17 years old, where I was quickly under a surgery on my neck, and then the doctor said you will have this illness for your entire life, so you have to face it. So at that point, I thought, okay, I have to live with, I have to do whatever the doctors say to me. And then the illness came back after 10 years after that surgery. I developed some tumors on my brain. Then I developed new tumors on my parathyroid. They removed in a second surgery half of my thyroid. Then they gave me pills to treat my brain tumor. And then after 5 years after that, I developed new tumors on my pancreas. I have a huge surgery. I had to learn how to breathe again. They removed half of my pancreas, no jejunum, no gallbladder. It was a nightmare, I would say.
Yeah, yeah. Um, I guess so. Prior to 17, were you aware of what Men One was?
No,
Okay.
I didn't know what every single organ was involved and was useful for what. Parathyroid, thyroid, pituitary tumors, pancreas. I didn't know what they do in your in your system, right? And the doctor just explained me what was happening with me and what is going to change on my body.
Yeah. And how did you like were you just getting a physical or how did they find out about um you having Men One?
It was a weird case because in Chile they usually do like 1 year physical control, as you said,
Yeah.
and they realized that I have high calcium on my blood. So then they told me that I need to see an endocrinologist, which for my perspective, I didn't know what endocrinologists do.
Yeah.
Um, and then the endocrinologist trying to explain me why I have too much calcium in my blood, and they perform different exams, and they realize that I have this weird illness.
Yeah. Um you know, I guess at, at 17 most people are carefree, young, feel they're invincible. I'm curious, how did this change your perspective on life? Um, did you become like a lot more mature and things like that, or how did this, um, getting this diagnosis affect you?
You are absolutely right. I felt invincible at 17 years old. But then doing all these weird exams on me, I realized that, okay, I'm not invincible. I have to do whatever the doctors say to me and then follow every single instruction. It was mind blown for me at that point. But then you you realize that for every single challenge, as you said, you will become more mature, and the way that you face tough things is gonna follow you for your whole life. So it was a change on my mindset.
Yeah. From a, an emotional standpoint, or a mental standpoint, um, were you fearful? Or, were you suddenly, a lot more aware of death and thinking about that?
Yes, yes. I change something that I change is spending my time and being grateful for what I was living. I changed the way that I spend my time with my family, my dad and mom, my sister, my brother. I would say that I learned from being sick of what is being grateful for living, being alive, you know? Yeah, that's, I would say that after being sick at 17 years old and after the surgery, I changed and I tried to think differently in my life.
Yeah. Is there anything in terms of, you know, I know you had a parathyroidectomy, that surgery. Is there anything as you look back on that, um, within that process that you would like to speak about?
Yes, it was my first surgery in all the surgeries that I have in this illness. And you will face your first surgery with a illness that you don't understand, like whatever needs to be, you are gonna do it. And after that surgery, the doctors gave me different pills for the brain team treatment and then uh, the problem with the calcium. And then I told them if I have to take 10 pills per day, I'm gonna do it. I'm gonna do it because I want to be healthy again.
Yeah, yeah. Um, I guess so. For after that process, um, or even during that process, as you look back, is there something you would say that family and friends can do to be supportive?
That's a very good question because in every struggle, I can tell you they are who are the most suffering with your illness. In every single exam, in every single blood test, surgeries, recovery, they are suffering a lot. And it's quite different if you are suffering the illness, because in my case, I can take pills for suffering. If you feel pain, the doctor is going to give you pills to treatment, right? You are going to have a surgery if something is wrong. But then with your family, there is nothing that they can relieve from what they are suffering with you alone. So I would say focus on what matters in my case and in the family, share and enjoy every single moment. Simplicity, right? And if you can do any activities together to keep that the illness away and just enjoy that time with them, that is pretty good for the people who is suffering every single illness. And if you can enjoy any activity together, that is going to change where your mind is with the illness. That is going to keep you away and you will feel better. You don't need to think every single time that you're ill, you have some health issues. That is a very good advice, I would say, for the people who is suffering with you, the illness. Just keep your mind away and enjoy every single moment together.
Did you have any mental low points, or were you pretty mentally strong throughout this process?
Yes, I have actually, I would say that I have two low points. And the first one, okay, they developed the illness at 17, then came back at 27. But then when they developed the new tumors on my pancreas, that for me, after 2 or 3 surgeries before, was something that it wasn't good. I was, at that point, I was pursuing an MBA. So I was studying, I was doing TOEFL, GMAT, some tests to come to the US and study. And it was very casual that they discovered the pancreas on the tumors on my pancreas, though, where just for the insurance, I need to do some exams. And the doctor said, okay, we need to check how is your pancreas, because we know that this illness could affect your pancreas. So we were in a small room, and then with 2 or 3 different doctors. And then he said, we see something that should not be there. Probably you need to think what could be the next step. And that for me was, okay, what's happening with my life again? He tried to explain me that this is very serious illness and you should take very serious because it's in the pancreas, right? The only way that this illness is developed, that you have something wrong in your pancreas, is when you have metastasis. And it could be because your kidneys are failing and something like that. It's going to be in like phase 4. So for me, I got lucky that they developed right on time. But then it was pretty bad at the same time because I was pursuing my dream to come to the US study. And then I have to postpone like 1 year after doing the surgery, all the recoveries. And it was a very low point for me. And the second one was doing the meantime that I was doing the MBA in the US. In the first year, the oncologist, after I brought all my exams in here and I have my oncologist and every single doctor in here, the oncologist at some point when I did the PET scan on my pancreas, just to see if everything is going well, the oncologist called me and she said, we saw some image on your stomach that it shouldn't be there. And she said, probably could be a metastasis. So I was so afraid at that moment that everything came back again. So she told me, next step, we need to do a biopsy. We did the biopsy. And she called me again after 1 day and she told me that the hospital lost my biopsy. It was crazy for me at that point, So as always, the mindset is very important. I ask, okay, what is the next step? Because you still feel the pain. And she said, we need to do it again as soon as possible. And I thought, okay, I put all my thoughts in, okay, we are going to do it again. Everything is going to be fine. We did it again. She told me that it's just a new tumor, but it's not metastasis. It's not the same illness. So at that point, I was focused on the results and everything went very good. It doesn't matter the process that we have. It didn't matter at that point. They lost it. Okay, that's fine for me. What I need to do to go through to this process and get healthy again. It's every single surgery I've been focused on what is my mindset to approach to get the best solution as soon as possible and recovery, full recovery.
Yeah. Yeah. How much, going back closer to 2003 time period, like as you went through, college and things like that, like when you're meeting new friends, is that like, um, how much would you talk about this aspect of your life and, um, things like that?
Can you repeat the question?
Like, yeah, like when you were make new friends in life, say from 2004 to, 2013, that time period, like, would you talk about this or like, how do you, or were you pretty private with this or how did you approach that aspect of, um, letting new people in your life know about this?
I love the question, Anna. I simply love the question. Every single time that I met new people at the college, university, the MBA, just meeting people of life, if I know that they are struggling with something, I would share as soon as possible what I struggle in my past or keep doing it. And why? Because if I can motivate people, if I can help them with anything, I will do it. If I can use my whole story, what I live, I'm gonna do it. I'm the happiest guy just to helping people. If I can talk with them, encourage whatever you are suffering, let's go together. I'm in the same corner that you are. Let's go together. And I enjoy that. I've been helping people whenever I can do it, I will do it. And that's a very good question because the way that I approach everything, if I know that they are struggling with something, I will make like 4 different questions. The first one will be, okay, what are you worried about? What is your biggest concern today in your life? It could be professional, personal, health, whatever you want to share with me, just tell me. Then I will ask a second question. Do you have any regrets in your life? Just to make them think about what decision in your life would you have do it differently, and then why? Just to know them, what they are facing right now. The third one is what if you have one desire in life, what it will be? Just to understand what they are facing, what they are struggling, how they can be overcome to that struggle. And the last one will be, do you think that your life has been unfair? And I can tell you, Arnab, after sharing my whole story, everyone is struggling out there with their own challenges. But you can, when you do these questions, just to understand what they are facing, then you can help them. If you want, if you try to give some advice to anyone without understanding what they are living, what they are going through, that is going to be just an advice. If you understand the right moment, what they are living, the environment, what are the challenges, then you can face the same problem in the same corner with them and help them with the process. And I love it. I love it. My best friends, every single person that I met, that I helped, that is a huge reward for yourself.
Yeah. Yep. So, you know, what is the process like from 2003 to 2013 in terms of like are you every year do you get a PET scans and things like that? And is that how in 2014 they discovered the hyper um calcemia again?
Yes.
Yeah.
So once you face this illness, it's gonna be always with you. And the oncologist, the doctor said, we need to perform every single year something, the MRI for my brain, the tumor on my brain. We need to do a scintigram exam for your neck. We need to do blood tests. We need to do a PET scan on my pancreas every single year. So yeah, but there is only one time that I'm worried every single year. But after that, I feel alive again.
Yeah. Yeah. So 2014, they find hypercalcemia again, and you get a second parathyroidectomy performed. Um, anything that you want to share from the 2014 year?
Yeah. So as I said, for that, the second surgery was I was taking pills, uh, the positive mindset, and it's something that also I learned from you, uh, how to sustain the positive mindset. And I listen, and it makes sense for me because I did at that time. I I didn't listen to you, right? But now listen to your podcast, it makes so much sense for me that how you face every single problem in your life, that is going to keep with you in your whole life. And how to sustain that positive mindset. Do not victimize you. So don't say that this is not fair. Just find a solution. That is a good way to maintain. The attitude is everything. How to face the problems, that's find a solution. That's all. And if you got a problem, focus every single process on finding the solution. And I did it. For that second surgery, I learned from the first one that, okay, I need to go, I need to finish whatever I need to finish for this surgery. I'm going to do it. And I was focused on the results, getting healthy as soon as possible.
Yeah. Um, I'm curious, during, before 2017, 2014 to 2017, you know, you got married. I'm curious, with a significant other, is there, I mean, is there something that you would tell other people in this similar position in terms of, things that the significant other should know, or, I don't even know, but is there any aspect of that when you're, um, committed to someone, um, that you would talk about or give advice on?
I would say nowadays, I find, I would say I found one sentence that it makes sense for me. And I told my wife every single day, today is the best day of my life. And it's because of, and every single day I will find something to put in that sentence at the end. So, for example, today is the best day of my life because I'm sharing with you my whole history. If I can encourage other people with my history, today is the best day of my life. I
Mm.
I can reach out more people because of you, right? And I love it. I love it.
Yeah. No, that's amazing. Thank you. Um, so 2017, you talked about it a little bit earlier, but you get an ultrasound done. They find a lesion in the pancreas. Do you want to talk about, um, this time period in your life, and um, you know, this was life-saving surgery, correct? At this
Yes,
point, yeah.
yes. And I can tell you that at that point, I didn't know what the same that the Steve Jobs said. I didn't know what the pancreas was. They explained me that it's quite difficult to find any lesion on your pancreas because it's a quite illness you won't realize. As I told you, with some failure in your kidneys, you is the only way that you will realize, okay, something is going wrong with my health, right? And I was so lucky that I had those exams with the doctors, and because just because they want to perform something in my pancreas, otherwise I wouldn't realize I'm probably uh, pass away after few months or a year.
Mm.
And I've been grateful for that. I got lucky. I'm a positive person. I always saw in my life, every single challenge, every single illness, every single new tumor, I'm lucky. I'm lucky. And at that point, the pancreas, I'm the happiest guy in the world. I love to feel alive after that. That for me was, I can tell you that was the worst surgery. The recovery took a lot, lot of time. It wasn't as easy as the surgeries on my neck the two times before. And the way that I approach was, I think, the best way that I could do. I can tell you that the surgeon came to me and told me after the surgery, okay, you have morphine, a button that you can press 10 times per day. It's going to release like small amount of morphine, but it's going to help you with the pain. And I just look at him and he told me, but every single person that I did the surgery and pressed that button every single day and 10 times per day, they took 2 or 3 weeks more for the recovery. And I was so focused on being healthy again that I never pressed that button. I just visualized me enjoying with my family out of the hospital. That's that's the mindset. Whatever the process needs to be, I'm gonna do it as fast as possible, at the best way that I can do it. But I'm gonna get the full recovery as soon as possible. And I did it. And the surgeon came to me after 2 weeks and he said, look, this is the first time that I see someone that never pressed the button and he's getting out of the hospital as so fast. And he said, congratulations, you made it.
Yeah. Um, in 2019, um, there was discovered to be a new tumor, desmoid tumor. Um, I believe you didn't have to do any surgery. You got pills. Okay.
Yes,
Um, is there anything else that you would like to say about the 2019 time period?
at that point, it was the problem that the oncologist told me. They thought, okay, this is a new tumor, but it's not on the same that we saw before. It's not on the pancreas, it's not on your neck, it's not on your brain. So this is very weird tumor. And they said, okay, could be metastasis, right? And they performed the biopsy. They lost it. They did it again. I can tell you that for that process, where I didn't have a surgery, but the biopsy was lost, it was so important the way that the attitude that I have, positive mindset, what needs to be done to finish as soon as possible. Doing it again, and then they told me, okay, this is very good news because it's not metastasis, but you need to take some pills because it's a huge tumor, which is it's okay, but uh, you need to reduce the how big is the tumor. So, and I told my oncologist, I told that's okay with me. I'm taking enough pills, and if I had to take 10 more pills per day, I'm gonna do it. I'm gonna do it. I'm so focused on the results and resolve every single problem with my health issues. So she said, okay, let's do it again.
How do you deal with fear?
Wow. Uh, Fear, I can tell you, Arnab, that fear is in your mind. This is a tough question. I will say that every single time that I face a new challenge, that's a fear for me. How I deal with that challenge or that fear is trying to find a reward at the end. If I feel fear of having every single time a new surgery, I will visualize me enjoying with any single person that I love to be with, enjoying with my friends, but
Yeah.
having dinner. So
Yeah.
visualize after the struggle, where do you want to be? And I can tell you that for me, not even having surgeries, taking new pills, going through the process of having an MRI, PET scan, taking more pills, that is the way that I face the fear. Visualize yourself with some reward at the end.
Yeah. Do you the all of these surgeries and the pills obviously have physical effects, mood swings, tiredness, things like that. How have you dealt with those physical effects? And like, even in 2017, you had to do a lot of physical therapy. You said you had to learn how to breathe. The physical aspect of all these things, any thoughts on that?
Yes, I I can tell you that, and it's important to understand why. I love my job. My job is like 60, 70% of my life. Why? Every single time that I had a surgery in the past, I ask for my computer. The question is why? Being sitting at hospital, lay down, doing nothing, that is gonna kill your mind. You're gonna feel like crazy. Feel feeling useful. Just probably send an email. That is gonna be very good to keep your mind away from the hospital. I can tell you that for me, the mindset is very important. And if you ask me how to deal with any single process, right now, feeling that I'm helping other people with my job is one of the things that it makes me happy. Not only in my life, you can help people just having a conversation, encourage people, going with it with any single struggle, but also with your job, with the daily job, you can help people. And that for me is something that I enjoy also in my life.
Yeah. Uh, I'm curious, do you have any opinion on hospital visits and, friends and family visiting you, after surgery or something like that? You know, um, when you're laying in bed, um, and friends or family come to you, what was your thought? Like, do you want them to, just watch TV with you and be there and support? Do you want them to, what was your biggest help um if they did something for you?
Just having a conversation what they are doing outside the hospital. The same that their job, having a conversation what is happening in the world outside the hospital, that is gonna help you with taking your brain out of the hospital and see other people's lives and people that you care of. For me, I have most of the surgeries. I have, I can tell you, several different friends visit me at the hospital. And I still remember few of them that when they saw me after the pancreas surgery, which was the worst, I felt, I saw through them, and I saw their eyes like suffering with me. And I can still remember those friends when they look at me and they suffer with me. You will never forget that moment because you feel it. And that is gonna give you, if it's a good friend, it's gonna be the best friend. They suffer with you. It's the same that we talk about with the family. They are the people who is suffering the most. And it's good to see them at the hospital. But I was in shock to see them suffering with me. Yeah.
Yeah. Christian, just from a third party perspective, right? The adversity you've been given in life, um, if you were very negative and if you were had a bad, view of life, right? I wouldn't blame you, right? From my perspective. You know, I'm curious, how did you develop this positive mindset and not, you have every right to be angry, to be negative, to curse. Um, how did you develop that mindset?
I realized that everyone has problems. Every single person is a different world out there. I realized that because I saw it, people who victimize themselves, people who said, this is not fair, and people who focus, who spend too much time trying to see why they have those problems. I mean, the why is okay if you spend the right amount of time and move off what I need to do. I saw too many people struggling and victimize themselves instead of focusing on how can I solve this problem. in my case, it's just genetics. So I didn't focus on, okay, is it my grandparent? Is it my mom, my dad? No, I said, it's okay. It's not happened to me. It just happened. But then what needs to be done? And that is going to be enough for every single challenge that I will face in the future. Okay, this is happening. The why is okay, but just spend 5 minutes, 10 minutes. Ask you, okay, why this happened to me? Is it my responsibility? If it's not, that's okay. If it's my responsibility, okay, how can I solve it? How can I avoid this problem in the future? And that's for every single problem in your life. You find the why, okay, what is the next step? What is the solution? What is the process that I need to do to, to go to find the solution? And then do whatever it takes to do and get that solution.
Yeah. Was there ever a point where you felt like you couldn't do this? You couldn't continue to be positive, or you couldn't go through this physical therapy, or you couldn't continue with life?
I can tell you, I can assure you that most of the people will have the same thoughts on it. I will say no. Why? Because I have too many friends. I have my family. I have too many people caring about me that this is not about me. It's about them. Then that's the first one. The second one is there are too many people that needs help, and I'm getting ready to help them. I'm always telling people, everyone is focused on, I want to help people, but I need money to help people. And I say, why do you need money? A lot of people just, what they need is just to be listened. And that's why I love your podcast. People can learn from other people. There is no problem in life that other person faced in the past. So if you can use your experience, what was the process that you did to resolve that problem? That is going to be a huge for one person that is waiting to hear about that experience. So that's the second point. There are a lot of people waiting to be listened, to share what was your struggle and how can you help them. That's huge for me also.
Yeah. How do you deal with anxiety and stress? You know, if you go back to your 2017 self, and the doctors are telling you, if you don't get the surgery, in a year and a half, you might, like, if we hadn't found this out, you might have died, in a year and a half. That's a lot to
But
obviously there's the positive that they saw it or they found it. But it's a lot of anxiety that if you don't do this surgery, um, there's a chance, you die. How have you dealt with stress and anxiety?
yes, so I have 2 points to answer that question. The first one was at 17, I was too young to face any problem. And the doctor, the endocrinologist, who handled a lot of different patients, she told me, because for me, was mind blown, right? And then she saw me, my expression, and she asked me, how do you feel? And I felt like I don't know what to do. And she said, what do you mean? And I said, what should I do? I should spend more time at the hospital, do it more. And she said, stop overthinking. Just do your life as you were not illness. You don't have any ill. Don't overthink about what is happening to you. Just do a normal life. And that for me was the best advice. I don't spend too much time thinking, okay, what happens to me? Why is this new problem? That was the best advice that she gave it to me. And the second one is something that I realized between the first and the second surgery. I was doing my normal life, but then I thought it should be something that I should be doing on a daily basis because I could be dead. And then before the pancreas, I thought, okay, what I enjoy the most? And I put a list with at least 15 different things that I would enjoy on a daily basis. So it could be a holidays, it could be a trip, but then simple things. So for me, running, reading a book, going out at dinner, having conversation with my dad, my mom, enjoying with my sister, my brother. Those things I enjoy on a daily basis. And one of the surgeries, I just want to walk outside, but I couldn't. And the hospital was, no, I didn't have one window in that time. So today, if I can walk outside, it's a sunny day and you can breathe. That for me is something that I enjoy on a daily basis. Simple things. And as I told you, with that, I developed the today is the best day of my life because of, and I found it. I found exercising, everything. And something that also you said, body and mind should be connected, right? To keep or sustain the positive mindset. If I feel healthy because I'm running outside, I'm getting good food for my body, my mind is gonna be healthy also. So you're right. You're right.
Yeah. This is a tough question, and you can say no to it. I'm curious if someone's in a similar position to you and they're listening and they said, okay, I want to get Christian's, positive mindset. And so they listen and they hear, okay, I need to be, you know, go through the challenge and where do I see myself? How do I visualize where I'm going to be after this? If they're struggling to see that visualization of, I'm going to, come out of these surgeries and be healthy, or I'm going to, if they're struggling with that hope of seeing that visualization, are there any strategies that come to mind?
I think it's related with also the mindset. And there are different ways. So for example, if the body and the mind is connected and you see that from unhealthy food, you won't feel okay. But then if you change that process to getting food that is healthy for your life, you will see minor changes. And at the end, you will see that that is going to change the way that you face some problems. So if you can use these lifestyle factors, if you can change a minor things, because you're right, probably not everyone is going to have a problem, see the solution because they change the mindset. and they cannot visualize the reward at the end. But I will say, okay, that huge reward for me, that having dinner with my family, enjoy single moments, I will say that you can break it down in small rewards. Because if you don't get it at the end with this process, that it could take months, it could take weeks, or if you are good, it could take just days. You need to focus in something that is gonna be near like small reward. I will say focus on, and everyone can see that the baby steps is very good because you will see baby rewards also. Focus on small steps and not at the end if you cannot do the process of the huge reward. One day at a time. That is very important. Very important.
Yeah. As you look at life, right, and especially for those of us that have never had a chronic illness or a life-threatening, surgery, um, is there like how is that? Is there an outlook on life that you'd like to, share with us in terms of, not getting into petty drama and things like life is bigger than that, or like how is this how is your life journey um maybe formed your outlook of life, or what is your outlook on life?
I would say I found my purpose because of the illness. And it's gonna sound crazy, but my purpose in life is to help people, is to encourage people, is to go with them with any single problem that they could face, go with them, see them on the same corner, listen to them. Because at the end, if you want to help people, you have to listen what they are living, right? But then nobody will understand what kind of problem you're living because it's a very particular reason that they are living that. So I will say that you can get an approach if you listen to them first. And with that approach, you will feel like suffering quite similar, not the same, quite similar. And from that perspective, you can help them. So for me, finding that purpose, but most important, how can I help people? So I found that process of listening people, and then the reward is they are gonna call you, they are gonna have a good talk with you, and they're gonna say thank you. Thank you for listening to me. Thank you for helping with that process. Thank you because we found a solution together. If you feel like you have the same problem, that is going to be the best approach that you can have to help anyone. And the purpose that I found keeps me alive, keeps me fighting every single new challenge in my life. And with you around, I can reach out more people. I can help more people. I'm very grateful for that.
Yeah. No, thank you. um Christian, we've talked about a good amount, uh from 2003, 14, 17, 19. Is there something that you wanted to pass on to us? Obviously, you have a very unique um, story and perspective on life. Is there anything else that you would like to pass on, or something that we didn't talk about that you wanted to?
Just one sentence I will ask to the people. What makes you happy? And pursue it. Pursue it. For me, it was related with my purpose. I'm very happy to help people. If you find your purpose and you can accomplish that purpose on a daily basis, on a weekly basis, monthly, on your life, it is depending of the purpose, that is gonna make you happy. So find what makes you happy. Uh, that with the time, I realized that you could be. Life is like a roller coaster, right? You could be as high as possible, then very low. You will find huge problems in your life, but then you will be happy at some point. But then again, something is going to happen. So if you can find the balance, and how you can find the balance is what makes you happy. At the end, if you found what you have, what makes you happy, it doesn't matter how low was the lowest point in your life.
Yeah, yeah. No, that's terrific. Christian, if anybody wants to reach out to you or support anything that you're doing, is there a best way to do that?
Yes, yes. I can uh, give you my email address or my telephone number. I'm very happy to helping people. So if you want, you can write it down
Yeah, yeah.
on on the podcast, or
Yeah, I'll put it in the show notes.
yes, yes, you can put even my WhatsApp. I would say that there is no excuse if anyone wants to reach out to me and need help, need to be listened, if they are struggling with any single problem. There is no excuse. You can share my email, you can share my WhatsApp, my phone number. They can text me, and I'll be the happiest guy in the world if I can reach out more people and help more people.
Yeah,
There is
that's
one
awesome.
thing enough.
Yeah, yeah.
How do you want to be remembered? And first, I want to be remembered. So at that point, if I reach out more people, I want that anyone can say, okay, he helped me when I was struggling. I want to be remembered at some point I helped the most quantity of people that I could have helped. Thank
Yeah. Yeah, yeah. No, thank you. Christian, I just want to acknowledge you, man. I don't know if you have the perspective to look at how strong you are and to see how much of a superhero you are. Personally, just being able to go through, the adversity that you've been through. Um, from a 17-year-old kid to, 27 to, um 29, whenever, the big surgeries were. But um you know you obviously this was set up because you changed someone else's life, a mutual friend of ours. Shout out to Pujata. um and that's an incredible gift that we had never met before. And Puji thought of you, you know, as a guest when I was talking to her. Um, it shows a lot about your character and that you are living your life's purpose of helping people, helping others through adversity, through the struggle, through seeing the positive mindset, visualizing, solutions and things like that. So, um, just thank you for that. And thank you for being willing to talk about, these things, MEN1 especially, and trying to inspire other people that, get the disease, or, disorder, um, find inspiration in your story and the way you handle yourself. Um, that's incredible. So thank you, Christian.
Thank you, Arnav, and thanks to Puji to put you in my life and have this conversation. I appreciate your time and the people who is listening to the
Yeah.
podcast. Uh, just want to help people reach out. My purpose. That's all. Thank you.
Thank you.